Hey guys, good evening. It's Dr. Lauren here and Dr. Katrina.
Hi.
Say hi. I drug her into this webinar. It is like late. We got started late. It's like 6:35-ish. Anyways, and we just finished up with patients, and Dr. K is a mom just like me, and we both had our unique breastfeeding challenges as mothers, and then we also helped a lot of our practice members and continue to help them overcome those challenges. So we just really wanted to come on here and share with you guys what our challenges have been and then how we overcame them and some tips for y'all to do the same. So first, let's talk about really the beginning of breastfeeding, because for me, it was a huge challenge, and for you it was too.
Right.
Like, it's an instinct, right? Like,
absolutely.
When you have your baby, you want to nurture them, you want to breastfeed them, but it's also a learned skill.
Yeah.
And I think I took that for granted, and you're hilarious when you tell me like your story and how you took it for granted. So do you want to share?
Okay.
You just roll up in there, have a baby, and you just think, just put them on there. It should
right.
be fine.
So, well, basically, we went to school together. We went to chiropractic school. We were both doulas. We've attended a million births. So
got all the book knowledge, right?
So part of your doula training, also, you have to go through lactation training to a certain extent as well. And so I thought, well, one, I'm a mom. Two, I'm born with these tatas, right? And then three, I was like, I know all of the book stuff that there is to know. So I'm going to have this baby, and I am just going to
stick it on
there, and it's just going to work, and this breast milk is just going to come flowing out, and
there's going to be enough of it.
Ta-da! Yeah. Like, it's just going to come naturally, instinctually, right?
No, hard turn to the left.
Yeah.
Not the case.
No.
So, first of all, and guess what? If breastfeeding doesn't come natural to you or didn't in the past, this is where I really just want you to let yourself off the hook, because it's no joke. Like, it's really hard. Now, some people get lucky, but those are the same kind of statistics like the woman that has a 2-hour labor and didn't feel pain and everything's fine, right? So the moms who haven't had challenges with breastfeeding, you're very fortunate, and we like literally worship you.
Right.
But for moms who have had challenges, we want you to know that even though it's an instinct, it doesn't mean it's going to come naturally, and it is hard work. So let yourself off the hook and know that's the case. But we want to give you some tips to do twofold here. If you are pregnant now or want to be in the future and you've never nursed a baby, or maybe you aren't pregnant now but you've had a baby before and you had challenges, or number 3, you currently have a baby. All these tips apply, okay? Because literally we should all be doing this if we're adventuring into a breastfeeding life. So things you can do: educate yourself beforehand. So one of the best things that I did, I had never really seen breastfeeding except for like the weird person at the mall that had their boob out and I didn't understand. So out of ignorance, I didn't really judge, but I was like, that's weird. But now, as a mom, then I'm like, what are you looking at? This is normal, right? But I needed to like see breastfeeding in the wild and like see like, how do you latch this baby and what happens? So I just literally Googled Latching League, and it's one of the biggest worldwide resources, Latching League, and they have local meetups. So I found one in Arlington. They still have that going on here, and it's amazing. So if you haven't tapped into the Latching League, say that 3 times fast.
I know.
3 times in a row. You should. So that's one way to get some education. You will get to see breastfeeding live and open and obviously you're in a meeting, but where people are openly, displaying breastfeeding, and you can see. I remember just learning so much from watching, like, oh, you can just nurse and talk at the same time. You're not like so involved, and it's natural for a baby to take a break and then want to get back on. And there's a toddler breastfeeding. Like, I know the World Health Organization says the average age of weaning worldwide is 5 years old, but in the US, I don't really see that. So, these moms are embracing it. And then I got to ask questions before I even had a baby. So that helped me huge. You want to talk about birth education?
I was just going to say too, with that, because when we talk about breastfeeding, what do we see and what do we know? Well, we don't see exactly how to place the baby.
Because when the baby's exactly on, you
how
don't see
to hold the
nipple.
baby,
Yeah.
you know. And I actually, this is probably pretty funny too. Like, I was like, wait, you mean I'm supposed to pick up my boob and like I'm supposed to put it in? It's
like you didn't know you had a part.
Like, yeah, because I was like, I just thought he was just gonna. Like, I don't know.
Yeah.
I had no
and then
idea.
you're like, this hand, and you gotta have your nipple pointed towards their nose if they don't do it naturally, and then you gotta put them here. Yeah.
Because any exposure you get is when the mom already has the cover on and everything is good, and then we learn about breastfeeding, but we have no idea what's going on behind
the scenes. How did they get them on there?
Yeah.
So next thing is birth education classes. So a lot of women may take birth education in a hospital setting. You may also take one with your doula or with your midwife. But if breastfeeding was not a part of that, or it was just kind of like, oh yeah, breastfeed your baby because it's better than not, but the mechanism of breastfeeding wasn't covered, then it's a great opportunity to really seek out a breastfeeding class. And you can post in like local DFW birth Facebook pages. You can comment here. We can tag doulas and midwives and all that here to give you resources as well. YouTube videos. Now, this is a dangerous thing because I'm sure there's some really wild things on there. But let me tell you, I had YouTubed how to get a deeper latch with my son because he had a really shallow latch, and I was like, I really felt like it was something I was doing, and it was. And I found this video, and it's the most bizarre thing. And I'm going to put the link in this webinar, so you'll see in the comments this video when we're done. And it is a video on how to get a deep latch, and this lady uses this balloon, and she literally shows that the direction your nipple is pointing will make the baby's latch like shallow on the balloon, and then she changes the direction and shows you how to point it up towards their nose when you're inserting. And when they open, they get a much bigger latch. It's literally so much better, and they transfer so much more milk because shallow latches are pinchy latches that bruise your nipples, that literally can cause little lacerations, and that's where you get that cracking, bleeding, burning pain. So that video was really helpful. So YouTube, although watch out, like don't YouTube that in front of a kid unless you know it's a good video, right? The other thing is find your tribe. So for instance, here we have mama meetups. All of our practice members, like all the moms in our community, they hold each other's babies when they're here to get adjusted. They ask each other questions. When we have our mama meetups, moms will come and they'll get to ask those questions. So finding your tribe is super, super important when you're adventuring into breastfeeding, right? So those are just some key things to do. Now, let's really get into challenges. So the first challenge that happens with breastfeeding isn't necessarily milk supply, although I'm not saying, how do I say this? It's like
it's like chicken or egg.
Yeah, that's the word I was looking for. So chicken or the egg first, right? So one thing you need to know about breastfeeding is that it is a supply and demand thing, and it's a feedback loop, okay?
Absolutely.
So the more your baby nurses and the better latch that they have and the more milk that they transfer and get, the more milk you're gonna make. So if you have a baby that has a shallow latch, that can affect your milk supply, okay? And we're gonna get into milk supply a little bit more in a minute. But one of the main things that affects milk supply is latch, and it can even affect it later. So if you're struggling with milk supply in the beginning or towards the end of breastfeeding or in the middle, this can be an issue. So latch challenges. Latch challenges are when a baby has a hard time latching. Signs of that is kind of what I just covered, the pinched or pursed nipple, like when your actual nipple is flat. Okay, and I mean flat, like not flat against your chest, but pinched. So a pinched nipple, cracking and bleeding, painful breastfeeding. Breastfeeding really shouldn't be painful, okay? So those are some of the number one signs of a difficult latch or a latch that's not optimal. So really what we want to cover next is what are the number one causes of latch issues. And that's really where we get into some of the things like our kids experience, which is lip and tongue tie. So first, let's start from the top. So latch challenges are because of an anatomical change in the baby's structure or function, and typically both of those. Structure actually controls function. So typically it's a change in their structure and function of their mouth, the way that the muscles are working in their mouth, the way their tongue is working, the way their lips are working, so everything they use to eat with, as well as the way their TMJ and their upper cervical spine is working, okay? Because these things work together to create a good, healthy latch and the baby's ability to transfer milk. So do you want to cover one of the number one causes that we see with latch challenges in our office?
Yep. So the number one cause that we see here is as a result of birth trauma.
Right.
And so we talk a lot about that here because we just see so much of it.
Right. And even in a healthy vaginal birth, but
absolutely,
especially in the other cases that we see.
Absolutely. And so, you know, there are a number of presentations of birth trauma, but one of them is actually a poor latch.
Yeah.
And
it's
so
one of the first signs.
It's one of the first that you can actually identify, right?
Right. So when babies are coming either through the birth canal or a cesarean, there can be trauma that happens to the top of the neck. And remember how I showed you, ta-da, baby's fine. You didn't know we had one, did you? So remember how I showed you the top of the neck and this first vertebra, as well as the nerves that exit here, has so much to do with the latch, because these nerves actually help to control all of the motion of the upper cervical spine, the base of the skull, the TMJ, the face, the teeth, the tongue, everything, okay? So this has so much to do with it. So birth trauma, and what we mean by that, because maybe your baby wasn't a C-section baby or a vacuum extraction or forceps, but oftentimes, you want to hold that for me? Yep. When babies are coming through the birth canal, doctors or providers will do a maneuver to help clear the baby's shoulder. That maneuver typically involves some rotation and some lateral bending to clear the shoulder, and you can see how that shoulder would come through, right? So this is a technique that's practiced really commonly, like even if the shoulder isn't stuck. And so we find that overuse of this technique, or the necessary use of it, even if it's necessary and it clears the shoulder, it can still have a long-standing effect, because this misalignment can cause stress in the motion. And remember, structure is what creates function, so it can cause a change in the motion of everything that they need to be able to nurse, and also the neurology of nursing, the ability for the actual impulses to come through the brain, through the nerves, to the mouth, and coordinate the motor function of nursing, okay? So birth trauma can happen with a vaginal birth. It's more severe with a forceps, vacuum, or C-section, and it's one of the number one causes that we find of latch issues. When we have babies in our office that have latch problems, we always go and just dig into it with you to find out really what was the mechanism for your kiddo, and also were they ever in malposition in utero? Because if you're having contractions and your baby had a head tilt or anything like that, that can just really start to change that alignment even more. So we specialize in finding that, troubleshooting it, clearing that out, so that a baby can have optimal function of the upper cervical spine, the TMJ, and all of the motor function of nursing. Now, the second thing that we find as far as anatomical changes outside of alignment is soft tissue. So soft tissue challenges are really hard as well. Dr. K experienced that with her son. What did he have going on?
So when he was born, he had both lip and tongue tie. And so it was quite a crazy journey for us, and it definitely complicated things.
Yeah, so do you want to tell them what a lip and tongue tie is?
Okay, so, I mean, your frenulum, basically.
Yeah.
So we'll start with the lip tie, and that is that little piece of skin that's underneath your lip. So when you pull and fold your lip up, I'll spare you guys.
Right? We're not going to show you a dental
just
exam.
about to, right?
Yeah,
but you just pull that lip up, and it's that little piece of skin that's attaching
that connects your lip to your mouth.
To your mouth.
Yeah.
Yep.
So that would be a lip tie. And then a tongue tie
is the same little piece of skin, thin skin that attaches at the bottom of your tongue, from the bottom of your tongue to the bottom of your mouth.
Floor of your mouth, right? So in many babies these days, which if you do your research, you'll find, or if you've been down this road already, you'll find that many babies actually have a slight genetic mutation called MTFHR that actually changes the way that their midline structures are formed. So for instance, midline is going to be the spinal cord and the rest of these midline structures here in the mouth. And so when we have changes in our genetic profile, that really creates those midline structures, which we can get into MTFHR. That's a whole nother webinar. We'll have to do that, right? I don't want to go too far off into that. There was like a fly, something down here. So anyways, back to midline defects. So when a baby has that, what happens is we get tons of stress and tension and restrictions in their ability to move their tongue and to actually get their lip, because their lip should come up over the nipple and cover a large part of the areola. But if they have a lip tie, they'll curl that under because they can't really get it over. And so they'll start to use compression they'll start to use suction instead of compression. It should be compression in the back of the mouth on the soft palate. But whenever they do not have good midline structuring, then they can't get their tongue where it needs to be, they can't get their lip where it needs to be, and they actually use their little chompers and their gums to try to get milk so they start compressing in the front and sucking with their lips versus compressing on the soft, pillowy, nice, soft part of their palate that won't injure your nipple. So with saying that, many kids nowadays, it's very prominent, they have lip ties and tongue ties. So what to even do about it? Well, first off, you may have been told in a hospital setting that your child doesn't have one. Don't always trust that. Oftentimes, the lactation consultants at the hospital can miss it. They're very busy, they have a lot of patients, and they're seeing the baby in one quick moment. So many times it can be missed. So if your mama instinct is like, something is wrong here, and I feel like my baby can't open their mouth enough, they're not latching deep enough, they're really chompy, then there's a very high possibility that they might have a lip and tongue tie. So what to do about it? Well, a few things. My little ones, they had a third degree, two of them, a third degree lip and tongue tie. And because we use chiropractic as our first go-to, just because first, it is like one of the most valuable things that we've ever used in our life before I was even a chiropractor, completely changed my life. But second, because it is our profession and we have it right in our hands, literally. So we turn to chiropractic. It's one of the most natural and safe things that you can do. It doesn't involve surgery. And I was always like, I didn't want to cut my little one's tongue tie or lip tie. I'm not saying there's anything wrong with that decision. Dr. K did that. Several of my besties have done that. You've probably done it if you're watching this. So no shame in that, but I was scared more of that than chiropractic because that's what I do all day. So with us, we actually just adjusted our baby on a consistent basis, and we did soft tissue release. So we released the restrictions of his mouth and his TMJ and all the muscles back here, and we also made sure that his palate was even, because whenever they have a tongue tie, typically they'll also have an uneven palate, which is the roof of their mouth. And if you can imagine trying to compress up against an uneven palate, you wouldn't be able to compress this high side, right? So they lack compression, and then they can't transfer milk. So worked on the palate, worked on the soft tissue, worked on the TMJ, adjusted their upper cervical spine. We never had to do a revision, okay? So we were able to move through things quickly. My milk supply didn't suffer because of it. We didn't have to do surgery. Babies were happy, healthy, breastfed them until they were 2 years old, both of them.
Your babies were big breastfed
and they were chunky fat babies, right? So that was just our first, it was the most non-invasive choice we could make. Right. Now, having said that, if their restrictions were so significant and we had done everything and that didn't work, then we would have had to result in a revision if we wanted to try to keep fostering that breastfeeding relationship. So know that there is always a time and place for revision, but I do always encourage conservative care first because it's conservative care, right? So Dr. K went through revision with her son.
I did.
And she was a scenario where they did some conservative care, but to reserve that breastfeeding relationship, she did get a revision. And it was hard, right?
It was really hard.
The recovery of it and everything was hard. So
it's just a long process,
Yeah.
and I wish I would have known really what I was getting myself into.
Yeah.
And then as a result of that, and because of the struggle that we had for the first 10 to 15 days,
Yeah.
I mean, then it resulted in low milk supply.
Because it just kept going.
Yeah, it just kept going. So it was kind of, we were already in the cycle.
Yeah. Yeah,
so
it's
I
hard.
just wish that I would have maybe had all of the information, but
and the resources.
you know, knowing the things that we know as chiropractors, I was hell bent on I am gonna breastfeed this baby.
And you did.
He is
for a
not
long
gonna.
time.
I did, but it was a struggle.
Yeah.
Yeah.
Well, and now, like with the knowledge and resources that we have now
Right.
and the specialties that we have now in this field, like we're able to help so many other mothers. And that's why we're doing this, because we literally want to stand in the gap for you and make sure that we can like be a bridge and help you skip over a lot of the drama that can happen and a lot of the tragedy of women giving up on themselves and on breastfeeding.
Absolutely.
So we just want to be a resource to you and literally bridge the gap for you so you can walk on the other side without as much of a, hardship as us. So we see babies in our practice every day that go from the struggle bus of not latching to latching amazing. Mama's going on to nurse them for years and years. And then not only that, but making sure that all of this is actually in alignment and working well. We also see these kids get to skip through some of the long-term challenges that can come with, okay, well, if we do the revision, but we don't address the birth trauma and the stress here, these babies that have lip and tongue ties or have breastfeeding or latching issues are actually pre-wired to possibly end up with neurodevelopmental challenges. Things like ADHD, things like a immune system that is struggling, ear, nose, and throat issues, because the same nerves that control latch also control the ear, nose, and throat. So even if you've had your baby revised, it's still great to really look into what are the anatomical things going on? Yeah. Are there misalignments from the birth process? And then how can we actually improve that so we can still have a really healthy baby and toddler and development and hit all those milestones? So last tip that I wanted to give you guys is really just to not give up. Whether it's milk supply or the latch issues we've talked about, we're here for you. Like, we want to give you the resources. We can help you with all of those things. We can also plug you into the people that you need that are not our specialty. So we have a huge group of lactation consultants. We have the La Leche League, the local group, which is amazing. We also can share with you the essential oils that helped with milk supply. I'll tell you my favorite right now. It was Young Living's fennel oil. Tastes like licorice, but I didn't care. And I would literally
I don't think you do at that point either.
You're like, whatever.
I'll
put
drink whatever.
Several drops in water, chug it down, and I'm telling you, my milk supply was super healthy. You should see my babies. So whether it's milk supply, whether it's latch, whatever it is, we're here for you. And we definitely want you to reach out and want to support you. If you're not in the area and you need that support, still comment, still reach out, we'll plug you in.
Because we even have someone on our team, well, not here in the office, but in our birth community, who does virtual calls and virtual consults. So even if you're not in the area, for sure reach out.
Yeah, absolutely.
We can get you in contact with someone.
Absolutely. So thank y'all so much for joining us. And we look forward to visiting with you next week. We'll actually be covering torticollis and plagiocephaly, which is rotation and lateral bending in the head and neck that can cause flattening of the head. And that's a huge topic. So we'll be talking about little ones that need helmets, how to avoid helmets, what to do if you've had a helmet, what to do to get ahead of the game, and all that stuff. So we'll be here to just share more about motherhood with you next Tuesday night. So thanks for joining us.
Bye. Guys. Good night.